Hello, everybody. I hope you can all hear me okay. You're all very welcome, and I'm delighted you can join this presentation. My name is Kate Madden, and I'm the course leader for the Bachelor of Science in General Nursing. And my talk today, I'd like to tell you a little bit about the programme. Okay, the Bachelor of Science in General Nursing, it's a 4-year honours degree programme, and it leads to the Bachelor of Science Award. With this award, you can register in the General Register with the Nursing and Midwifery Board of Ireland, and that allows you to practice as a registered nurse in Ireland. What is general nursing? General nurses work as part of the multidisciplinary team. They care for individuals with health problems right across the lifespan, from birth to end of life. And the role of the nurse is to support them to live their lives to the maximum potential. The purpose of the programme is to ensure that on successful completion, that our graduates are fit for purpose and that they're equipped with the knowledge, the skills, the attitudes, so that they can practice as a competent and professional nurse. This is the Department of Nursing and Healthcare building in WIT, and I'm sitting in this building at the moment. It's called the O'Connell Bianconi building. It's quite a new building that was built purposely for the nursing and healthcare programme. This is the interior of the building. So as you can see, actually, it's a lovely building. It's nice and bright, it's open. It's got 3 levels. The bottom level, you've got the large lecture theatres. On the second level, you have our clinical skills laboratories. And on this level, the students practice and they learn their practical skills. On the top floor, then you've got small lecture rooms where we would do small tutorials with students. There's also an information technology room, and there's lots of open spaces for students that they can sit. So it's actually a lovely environment. Let's look at the top reasons for choosing general nursing as a career. General nurses very much make a real difference to people's lives. While it's challenging, it's a very rewarding career and it offers many career pathways. Nurses continually work in environments that support their learning and support their skills development. With the nursing program, you can specialize and you can learn new skills throughout your career. There's great opportunities for you to work in Ireland at the moment. You can also travel with the nursing degree, and we have our nursing students in many, many countries right around the world, and our degree is internationally renowned. What's expected of a general nurse? Well, a general nurse or general nursing students, they need to be committed to a high standard of care and a high standard of practice. They require key knowledge and skills and attitudes to be able to work as a nurse. It's important that people accept the uniqueness of each individual person that they encounter. Communication skills is very important to be able to communicate with patients and to be able to communicate with the multidisciplinary team. You need to enjoy spending time with people, and you need to understand, I suppose, the role that the family have in the patient's care. I think you also need to be passionate about caring and passionate about nursing. And nurses, a key skill for nurses is that they're very curious and that they're very questioning all the time, questioning their practice and questioning what can you do for patients. In terms of the attributes of a general nurse, there's actually no specific nursing type of person, but I suppose the key attributes that we look for in nursing students are that they would have the knowledge, skills, and attitudes to be able to practice as a nurse. And if you're wondering if you might be suitable for the nursing program, there is actually a self-assessment questionnaire here. The link to it is there. And if you complete that questionnaire, it actually asks you key questions that helps you to decide if you think nursing might be the career for you going forward. In terms of attitude, nursing is very much guided by the core values of nursing and midwifery. And they are caring, compassion and commitment. They're key attributes that we require of all nursing students. Other traits include that you're person-centered, non-judgmental, and again, that you understand the uniqueness of individuals, as I said. In terms of knowledge and skills, nursing students actually gathers the knowledge and skills throughout the 4 years of the program, and they obtain that knowledge through the theoretical component of the course, which is delivered as classroom lectures. They also gain the knowledge and skills through the practical skills that they're doing in the clinical skills labs. 50% of our program is actually given over to clinical placements. So you will be out there working in different clinical placements, practicing as a nursing student. So our program is very much grounded in practice, which I think is a key strength of the program. Of course, for any degree course, there's assessment is involved, and there is an assessment of the theoretical component, and there's also an assessment of the clinical component. In the 4th year of the nursing program, then you have 36 weeks where you work as an intern, and that's where you're paid, and you become an employer in the service, an employee of the service. And that's 36 weeks in the 4th year of the program. One second, I go back there now. To make an application for the nursing program, it's through the CAO, and you can apply as a standard applicant. And applying as a standard applicant means that you apply on the basis of your leaving certificate results. If you're 23 years of age and over, you can apply as a mature student. And with that application process, you do need to undergo an assessment. The assessment involves an assessment of numerical skills, your verbal skills, and we also do an assessment to see if you would be a good fit for nursing. In terms of the CAO requirements for the general nursing program, you need to have obtained in the Leaving Cert a minimum of grade H5 and 2 papers, and a minimum of grade 06, H7 and 4 papers in the following subjects. And they are either Irish or English, maths, and you require a laboratory science subject. And that can either be biology, physics, chemistry, it can be physics and chemistry, or it also can be agricultural science. You also require 3 other subjects. And it's important to note that foundation level maths and foundation level Irish are not acceptable. This booklet here is called Nursing and Midwifery, A Career for You, and it's a fantastic booklet. It can be accessed through this link here. And that booklet actually gives you all the information that you require about the nursing programs in Ireland. And it gives you detailed information about the application process and also the key deadlines for application. So if you haven't had a look at this booklet, download it and have a look at it. It's very informative. On this slide here, you can see the range of points for the general nursing program in 2020. So there's a number of different programs there, but for general nursing, you can see that the range of points were from 422 to 544. And you can see how that compares with the other programs. For the integrated children's and general nursing program, the points are higher, they're 500 to 533. For the psychiatric program, the points ranged from 366 to 554. For the intellectual disability program, then the points range from 377 to 419. And the midwifery program, then points range from 440 to 495. In WIT here, the programs that we offer are the general nursing program. We also offer the psychiatric program, and we offer the intellectual disability program. We have talks being delivered on the psychiatric program and the intellectual disability program at 3 o'clock if you'd like to attend any of those. And we also have booths if you require would like to ask any questions in relation to them. On this slide here, it gives you an idea of how the 4 years are divided between the theoretical component of the course and the clinical placements. For example, there you can see in year 1 of the program, you spend 27 weeks in classroom doing the theoretical component, and you've got 8 weeks on clinical placement. In the second year of the program, you do 16 weeks of theory and you do 16 weeks of clinical placement. On the third year of the program, you do 19 weeks of theory and 19 weeks of placement. On your final year of the program, then you do 12 weeks of theory, and then you actually do your internship, and that's where you do your 36 weeks where you become a paid employee of the service, and there's 2 weeks orientation and induction for that. So that's what your 4 years would look like. In terms of the program at the moment, I suppose with COVID at the moment, we're very much delivering the program using a blended teaching and learning approach. So all of our theoretical component at the moment is being delivered online, and it's delivered online using Zoom virtual classes for our students. So our students are having synchronous classes, they're live classes where they're live with the lecturer giving a class. We also have asynchronous classes, and that means that the student is assigned tasks to complete, but they can actually complete them in their own time. Then for the practical skills component of the course, students are coming into the skills laboratory at the moment, and they're getting those skills in the college. And we're very much using safe practices in terms of infection control and social distancing for those skills, for that skills delivery. In terms of classes, then you may be in a class with a large group of students. So for some classes, our general nursing students actually come together with the psychiatric nursing students and the intellectual disability students, and they would have some of their lectures with them. For other lectures, then they will be having like small tutorial groups, and that might be a group of 10 people that will be having a tutorial related to their discipline. So as you can see, there's a diverse range of teaching and learning methodologies used in the program. Excuse me now for a minute, and I just go back. Okay, students are taught throughout the 4 years using a model known as the KSV-SE model. And that model just means that throughout the 4 years, the students are gaining the knowledge, they're gaining the science, the values and attitudes, the skills and the experience they're required to be a registered general nurse. Okay, I'd like to show you what a typical year would look like in the BSc in general nursing, and I've selected year 1 here. So if you were coming into the general nursing program in year 1, there's 2 semesters in the year. The first semester runs from late September or early October right up to December. And during that period, you would engage with 6 modules. You'll do a module in anatomy and physiology, a module in learning to learn, which is the study skills module. There's a module in general nursing skills and experience, a module in personal and professional development. You do an introduction to general nursing module, and you do a module in relation to professional and patient safety. And then you're assessed in relation to those modules, and that's semester 1 completed. So after Christmas, then in January, you would come into semester 2, and again, you would engage with 6 modules. You do another anatomy and physiology module. You would do an introduction to evidence-based practice, or an introduction to the science of nursing. You do a module in the fundamentals of general nursing. You do a medication management module. You would do a module in terms of health and psychosocial studies. So that's where you'd be doing psychology, sociology, and health. And then you go out to clinical placement, and you would do 8 weeks of clinical placement. There's a big emphasis in relation to our clinical skills teaching. And here you can see on this slide here, we have a number of pictures of our students engaging with clinical skills. And this is in the clinical skills laboratories that we have. So students are learning the fundamental skills, whether it's skills in relation to giving CPR, giving injections, communication skills, and so forth. So they're all learned in our laboratories. This is a recent picture that was taken of a group of students and their lecturers, and they're doing a manual handling course. And you can see for this course now, the students and staff are in PPE, and they're social distancing. So that was a recent picture that was taken. In the program, you have a lot of support to help you, and every student is allocated a study advisor. The role of the study advisor is to assist and support the student in transitioning to third level education. They also help the student to adapt to third level, and they're there to guide them in their academic work throughout the 4 years of the program. As I said, the clinical placement forms 50% of the component of the course. So on clinical placement, you'll be working in medical departments, you'll be working in surgical departments, you'll be working in care of the older adult setting. You also go out to the community and work in different primary healthcare settings. You also do specialist placements. For example, you'll go to the emergency department, you'll go to the operating department, you'll go to a children's department, you'll go to a mental health setting, and you'll also get the opportunity to work in maternity care. And all of our students very much enjoy that. So there's a diverse range of clinical placements, and it's a key part of the program, and you really get to see what nursing is all about. And as I said, the course is grounded in practice, which is good. So it means that when you qualify, you're very much qualified to take up the role of a general nurse. Again, where do the clinical placements take place? Well, they take place in the southeastern region of Ireland, and that can include, you might be allocated placements in Waterford, you could be allocated placements in Tipperary, you could be allocated placements in Kilkenny, Carlow, or Wexford. And it really depends on where you live in terms of where you're allocated clinical placements. And these are the 8 hospitals that our students would be allocated to. But they're also allocated to community settings and community placements within those regions. On clinical placement, again, there's a big network of support for the student. Every student is allocated a preceptor. And what that means, it means that you will work alongside a registered nurse. And if you like, you shadow them and they take you under their wing and very much help you in practice. You also have the support of a clinical placement coordinator, and the role of the clinical placement coordinator is to oversee your placements and make sure that you're getting on okay. They will check with you on a daily basis how you're getting on, if you're having any difficulties. The linked lecturer is a lecturer from the college, and they will link very closely with the clinical placements to see how the students are getting on, and you may get to meet your your lecturer on clinical placement. There's an allocations team, and the role of the allocations team is to allocate your clinical placements and find your clinical placements for you. So they'll be in close contact with the student. Developing competence is a big part of the general nursing program, and the nursing student needs to develop competence within all of those areas. We've 6 domains of competence. For example, communication would be very important in nursing. Nursing knowledge is very important. Decision making is very important. And being a professional is very important. Management and leadership is very important. So they're key competencies that you acquire throughout the 4 years and that you're supported in developing. And these are the competencies that you're assessed on in clinical placement. Waterford Institute of Technology and the nursing department here were very much a student-centered college. It's a small college, so it's great from the point of view of all the students tend to get to know each other. You get to know your lecturers very well. All lecturers tend to have an open door policy. So it's a nice college actually to work in, and a lot of our students really enjoy it. In terms of the career pathways, you might be wondering, you know, what does a general nursing degree, what are the opportunities once you've qualified in general nursing? Well, it is a career that will give you many possible pathways. Many of our students would go into practice and work as a registered nurse. There will be a staff nurse in a clinical setting. It could be a medical ward, surgical ward, pediatric ward. They can do further study and become a clinical nurse specialist. So you may have a clinical nurse specialist in emergency nursing. You could have a clinical nurse specialist in wound care, and so forth. You can also do further studies to become an advanced nurse practitioner. And there you would take on maybe your patients independently, and you're a very advanced practitioner to be an advanced nurse practitioner. You could also go down the route of nurse education and research. So again, you would undertake further studies and you could work as a nurse educator or a researcher. And perhaps you prefer to go into management, and there's different levels of management that you could go into. You could be a ward manager, and you could go up to a clinical nurse manager, director of nursing, and so forth. So as you can see, there's many diverse pathways available to you once you've done your undergraduate general nursing program. So where do nurses work then? Well, many of our students, once they qualify with us, some of them will go and they'll work in an actual general hospital. Some of them might actually go out and work in a GP practice. You could work in schools. Some of our students travel and work in various countries. So, we've had students that have actually gone and worked in the prison service. We've got students that have gone and worked in the army. You could work in a nursing home, or you could also work maybe in a laboratory setting. So there's many different opportunities for you and diverse settings that the nurse can work in once they've done their primary degree. In terms of further education then, once you've done your undergraduate general nursing program, you can do further studies. Perhaps you're interested in specialising in children's nursing, so you could go on and do 12 months and become a children's nurse. You can also undergo a program where you qualify to be a midwife and do a midwifery program. You can also do further education and become a psychiatric nurse or a public health nurse. You can become a nurse educator. And there's also a wide range of specialist courses that you could do. So if you've got an interest, for example, in diabetes, you could do a specialist course in diabetes nursing or a specialist course in wound care. And there's many of these courses available to you. And they are short courses that you would undertake to specialize. In terms of what are the strengths of our program, I think one of the key strengths is the broad range of placements that a nursing student goes to. Nursing students very much are key members of the nursing team, and they're valued, and their contribution is very much valued. Healthcare settings love to have nursing students because they do bring a lot of energy, they bring enthusiasm, and they bring a real questioning approach to their practice. They're not afraid to challenge the status quo, and they do bring up-to-date knowledge and skills with them as well. So, as I said, hospitals and healthcare settings love our students once they come out in placement. Our nursing students are the future of our workforce, so that's one of the reasons why they really are valued. Nursing students are now offered permanent contracts once you qualify, and that's great because there's not many degrees that you can do where you're guaranteed nearly full-time work. And as I say, the HSE at the moment are offering permanent contracts for our graduates. We have high retention rates for our new graduates, and a lot of our new graduates will stay in Ireland and take up these permanent positions, but you also have the opportunity to travel, and many of our graduates do travel as well. They tend to go to places like Australia, America, Canada, UK, of course. And we have a lot of recruitment agencies that come over and they're trying to steal our lovely nurses away from us. But I think one of the key strengths of our program is that when you qualify, you are fit for purpose and you're fit for practice. And that's enabled, I suppose, by the 36 weeks of internship that you do in the 4th year of the program. And in conclusion, I'd like to just leave you with the student's voice. Now, this was one of our students, Roisin O'Connell. She's a graduate from 2019. This is part of her testimonial that I've taken here. And she said, with the support from the team in the WIT nursing department, I've excelled beyond my imagination. They've supported me throughout my 4 years through both failure and success, and I'm proud to say that I am a WIT graduate. WIT support their students to become the best nurses that they can be. They teach us how important we are and what an integral part we play in our patients' lives. We are the ray of sunshine in our patients' day. We're the beating heart of the Irish healthcare system. We can make a difference if we just believe in ourselves. We are the future. And as I said, they were Roisin's words, and she's a recent graduate from our program. And she's working in acute care now as a registered general nurse. Okay, so there's some contact details there from social media for WIT and for our course. So again, Dr. Linda Sheehan is joining me now, and if you'd like to ask us any questions, we'd love to answer them for you. So if anybody's got any questions, don't be afraid to ask us.
Kate, you can stop recording there now.